Hello, listeners and viewers. Welcome to the first Hurt App Healthcare podcast. I'm Dr. Brett Miller, an orthopedic surgeon and the CEO and co-founder of Hurt. And I have with me
Dr. Fred Liss, and I am the president of Hurt, and really glad to be here. Thank you.
Yes, we're going to dive deep into what Hurt is and how Hurt is affecting and sweeping practices across the nation to provide not only 24/7, 365 access to MSK care, but also to affect every corner of the MSK ecosystem. On this first episode of the Hurt Healthcast, Dr. Liss, tell us a little bit about who our guests are and what we're going to be talking about.
Thanks, Brett. We have with us today two extraordinary CEOs. We have Kim Marden from Watauga Orthopedics in Eastern Tennessee, and we have Andrew Wade, who is the CEO of OrthoSC, or Ortho South Carolina, along the South Carolina coast.
Yeah, two exceptional leaders in this space who are well respected throughout the orthopedic community. They are truly innovators and they're just great human beings. And I'm a little jealous, Fred. What is that in your background? What do we see in there? It doesn't look like my background.
Well, there are some benefits of retirement, and I am at my happy place in New Hampshire. So you're seeing me sitting on my porch looking out at a beautiful lake in Mount Washington. But Brett, I got to say, I am inspired by these people as well. I'm really excited to talk to these two. They're fired up individuals who really understand healthcare and are driving leadership in healthcare. So this is really an exciting moment for us at Hurt, and also to just really meet some cool folks.
Just fair warning. I'll just tell you that Kim Marden is not afraid to speak her mind and tell her truth. So this is going to be raw and live, and we have not talked to these folks in advance. You're going to get it straight from the heart, straight from them, and we're going to see what happens here.
Yeah, and one of the things that Brett, that I know that you've led the way with our company that really makes it exciting for me is that we pivot, we listen to our customers and our clients. We feel like they're our partners, and we'll take what they tell us and we'll go home and we'll work on it. So we're really open to what they've got to say today. So I agree with you. I think this is going to be clean and nice and meaningful to us as a company.
Yeah, we're looking forward to getting this going, and let's get to our guest.
All right, terrific. So here we are at our first Hurt Healthcast, our first podcast, and we're really grateful to have some guests that work with us, that are our partners. We have Andrew Wade who is the CEO of Ortho South Carolina, and we have Kim Marden, who is the CEO of Watauga Orthopedics. Brett Miller, who is the founder of Hurt, and my partner. And what I'd like to do is just have everybody introduce themselves briefly, and then we can start a little discussion. So Kim, ladies first, why don't we let you go first?
Well, hello, I am Kim Marden. I am the CEO of Watauga Orthopedics. Watauga Orthopedics is located in the beautiful East Tennessee mountains. It is the best place to be in the whole United States, as far as I'm concerned. I am with Watauga Orthopedics. As I mentioned, we are a group of 22 orthopedic surgeons. We've been around since 1950, so a very long time. We have 3 locations in East Tennessee, as well as our own ambulatory surgery center. And I have been with Watauga for 16 years and have been managing private physician practices for 27, my entire career. I started when I was 14.
That's
great.
Awesome. Well, thank you. How about you, Andrew? Tell us a little bit about yourself and maybe your practice as well.
Sure. So I'm Andrew Wade, CEO for OrthoSC. I think the short intro of this is that I'm really trying to be just like Kim. I'm still working really hard on it. I got a long way to go, but that's my goal in life. So we're not in the mountains. We're actually on the northeastern tip of South Carolina at the beach. And so the other side of it, the fun thing is most of the time the people who live here in our community go to where Kim is for vacation. And I think a lot of the folks in that community come here for vacation. So
That's right.
we just trade geography whenever we're not at work. So we've been around since 2018. We were the culmination of 3 groups that have been around the community since I think 1984, I think it was. And so our physicians have been here in our community for a really long time. I've actually been around the group and its physicians since 2009 and have kind of evolved and grown with the group as it has evolved and grown. So excited to be here. Happy to be part of the conversation. Thanks for having us.
It's a pleasure to have you. Brett, I'd love you to introduce yourself. Brett's our CEO of Hurt. How about you tell us a little about your practice and how we got here?
Sure. Number one, I don't live in a beautiful place. I live in the
Mm.
middle of the country here. I am next to the world champion Chiefs. I always have to get that in there. But I'm an orthopedic surgeon in private practice. In June of 2024, I'll celebrate my 20th year in private practice. And I'm the CEO and co-founder of Hurt. And we can go deep into why Hurt exists. But I literally just finished clinic. I'm in one of my clinic rooms because I didn't have time to get home. So I'm still an active practicing community orthopedist, still take trauma call and still face all the challenges that Kim and Andrew face on a literally a daily basis now.
Thanks, Brett. And I'll just briefly introduce myself. I'm Fred Liss. I also am an orthopedic surgeon. I retired from my active clinical practice at Rothman Orthopedics last year, but I've been engaged with healthcare, value-based healthcare for a long time and got interested in what Brett was doing at Hurt. And so when I decided to exit from clinical practice, aside from a little bit of clinic work that I do at a free clinic, I really embraced my time by doing the next step by working with Brett and on this model of uh, patient access through Hurt. So I'm really glad to be here, and it's a pleasure to kind of MC this. I think what I'd like to do is start off and maybe ask Andrew and Kim, you know, what what was the journey that brought you to engage with a company or partnership with Hurt? What are the conditions and things that maybe you could tell us why this was an attractive option for you?
Andrew, why
You
don't you go first? Yeah,
Yeah,
Andrew.
Sure. Okay. So I think in short, our community is not unique, but the conditions that we operate in are unique for us. We have 4 hospital systems that surround us, and so we are sort of sandboxed in, if you will, everything from level 1 trauma center to level nothing community hospital. We do cases in all 4 of those hospitals, 2 ambulatory surgery centers. And so that is a really fantastic thing for our community. It means that competition is fierce and intense. It means that quality is high or you won't survive. And for us, while you guys can't see it, but it's definitely giving me a gray hair here and there as I've worked through these challenges on a day-to-day basis. But our community is fortunate to have that. And so as a part of competing in the landscape that we're in, we are constantly looking for how do we accelerate the experience for patients? How do we make it easier than it's ever been for a patient to connect to one of our physicians who are delivering, high quality, cost appropriate care in the right setting for them. And so this was a huge opportunity for us to take the next step forward. I joke a lot of the times that healthcare has traditionally been, at least a decade behind everything else. And
Mhm.
so this is really kind of a leap forward, if you will, to sort of join the commonality of where the internet age is and where the access of telemedicine has really culminated in this, super easy to use app and now a web-based interface. So if you're sitting in front of a laptop or a computer, you can use a full keyboard to do it. For lack of better words, it's idiot proof. Even I can use it. And it's just one more way that we are connecting people to great care.
Awesome.
love that. I love that. Kim, how about your perspective on it? What drew you in a somewhat similar but also quite different community where you
Sure.
live? Mhm.
Yeah, I want to ditto everything Andrew said, but we are a different community, and Watauga Orthopedics have been providing an urgent care setting since the early 2000s, and so we knew the power of being accessible to patients. And listen, we live in rural East Tennessee, and if patients want to access us from that standpoint, then we know that patients are out there and the healthcare consumer is becoming very savvy. And so they're becoming very savvy of what their healthcare costs are and what their options are. So as time went by and we kept expanding our urgent care hours and our walk-in hours, we knew that we could not be available 24/7, 365. However, we also knew that our patients in this community deserve an option besides going to the emergency room. And so that is the benefit of HURT is we are still able to take care of our patients, but we don't have to be open every day, 24 hours a day. We've got a trusted partner that when we close our doors, we'll be able to refer them back to us for those instances that we can take care of. So it was a win for our community.
Love that. And I have to say, I want to ask Brett this question now. As orthopedic surgeons, one of the things that he and I definitely have felt over the lengths of our careers are the pushing apart of patients away from us and sort of the loss of this connectivity that we have. So, Brett, maybe you could address what it was that inspired you to identify that and how you wanted to solve that problem, because both Andrew and Kim, I think, are hitting on very important points, and that's a point of access to your practice.
I think Andrew and Kim are obviously great leaders, extremely well spoken, and their heart and minds are in the right place. And it's really refreshing to have leaders come on this first of many podcast and really just put the patient back at the center of this. Healthcare is such a disaster right now, both as a consumer and as a provider. I'm 50 years old now, so I'm starting to consume healthcare a little bit. Um, and just the barriers to doing anything in this space is very frustrating. And like Andrew said, we are now used to, as a society, to be able to access everything that we need on our phone or through the internet.
Mhm.
And healthcare does a disastrous job of embracing the consumer. And really this whole journey started for me with immense frustration day in and day out in a clinic just like I did today, where someone started in the emergency room because they didn't know what to do. They had no way to get advice. And then they get shipped to the wrong doctor, and then they miss another day of work and they spend another copay. And in my community, which is very blue collar, when these people miss work, it's a downstream ripple effect to the companies they work for. And that absenteeism cost is something we don't even measure. So we know that if they would just start with our specialist in our clinics, we're going to give them cost effective, excellent care that minimizes their time off. And quite frankly, I wouldn't have started Hurt if Hurt existed. I wanted to just find this product and I searched and I searched. It didn't exist. So we were left with the only option, which was to build it.
So, Kim, that's great, Brett. And Kim, I really loved what you just said a moment ago about, patients want an alternative besides the emergency room. I know as a doctor, we know that many, many patients that have musculoskeletal injuries do not need to go to the emergency room. And it's a very high percentage of people that have those injuries that actually end up going, and they don't need to, they get discharged right away. So I'm wondering, in your community, Kim, has that been particularly problematic? Patients just going to ER and then maybe coming out the other end, not necessarily with the right recommendation, or a delay of care, or a roundabout treatment for them. Have you seen that in your community?
So here's the problem with that is they go to the emergency room and let's face it, lay people, and I'm including myself, don't understand when you need to seek emergency attention and for a fracture or when it can wait. All right. So you end up going to the emergency room. So you end up spending thousands in the emergency room. And guess what happens? The emergency room physician treats it, splints it, does whatever they need to, and they say follow up with ortho. And guess what that has done to our patients? So not only do they have the expense of the emergency room visit, they're also going to have your expense of you evaluating it. Sometimes you have to re-x-ray it. Sometimes the splint is not put on correctly. So a double visit for the patient. And that in our area, was experienced all of the time because every single orthopedic office closed at 5 o'clock. And unfortunately, you cannot predict when you need an orthopedic surgeon. Those accidents are usually somewhat unpredictable. So this has made a huge difference in our community, and we're consistently trying to educate our community in this fact of coming to an office instead of the emergency room.
Great point and great points. And Andrew, you mentioned that there are a lot of different types of hospitals, tremendous competition in your marketplace. How has that, ER visitation thing affected the patient population? And then maybe we can transition into talking how hurt and adopting hurt has changed that dynamic a little bit for your practice.
Sure. So I'd echo what Kim said, right? I mean, it happens to us all the time. There's no access after 5 p.m. from the ambulatory side of the universe. I mean, now our urgent cares have fixed some of that, but we can't be available 24/7. And I don't really want our hospitals to go anywhere, right? I mean, we need them for the cardiac stuff and the
Mhm.
stroke stuff and all the other big problem type stuff that we're never going to take care of that sort of stuff under our roof. But exactly like Kim said, the reality is that, even having worked in the industry as long as I have, if one of my kids gets hurt, I don't know, either my brain turns off or I just go into parent mode. I'm going somewhere and I'm going now, right? I'm not going to
Yeah.
wait. I'm not going to stop and open a book and start working down a
Mhm.
diagnosis system to get to that answer. And I think it happens frequently in our community, not just general injuries, but sports teams. We have a lot of travel teams that play in our
Mhm.
area, and so people are in and out for the weekend. They don't even live here; they're just here for the weekend for a tournament that they're a part of. And this stuff happens all the time, and I can tell you if you land in the super high acuity level of care setting in our community, it's thousands of
Yes.
dollars.
Yes.
But even if you land in the level nothings in our community, it's still extremely expensive. And so, not only is it a big deal for the absenteeism type stuff for the employers, but I'd venture to say that most of us on this phone call, and probably most of us who will listen to this podcast, we're probably okay, right? But there's a whole bunch of people walking around our community that it will really meaningfully impact their family to have that additional bill that's not necessary. And the only reason that it's happening is because they don't have a better pathway.
Mhm.
Yeah. There's another piece to this, and I know Brett is very passionate about it, so I want to ask him, and that is the humanistic features of what we're doing here. You know, Brett will tell you, he can tell you stories about how, Saturdays and Sundays at his house in St. Joe, Missouri is like an open clinic. People come over and stop in because, when people who know doctors have a problem, they call the doctor. Well, most lay people don't have that. And the humanistic side of it is, why shouldn't everybody have that orthopedic buddy? Why shouldn't they have access? Why should you, as a parent or as a spouse or a significant other, feel like you don't know what to do and you have to go to a facility out of fear or out of worry? Why not be able to go somewhere with a decided thought process that makes sense to put you, in the best place for the best care at the right time? Brett, maybe you can just say a few words about that because I know that's an
Sure.
important thing to you.
I mean, I was born and raised in the community that I practice in, so people know me. And my wife would attest that literally my home is like a 24-hour urgent walk-in center. I never say no to people wanting to stop by after a game and look at a sprained ankle. And I mean, we got a whole, first aid system in our house where she can go grab some sutures or splints. I mean, literally, it's like a mini orthopedic clinic at my home. But ultimately, that's what we signed up for as orthopedic surgeons, and this is why we're in healthcare. I just went to a huge conference, and I was so taken back by the fact that there was only about 3 companies there that were actually there for the patient. Of course, we're one of them, but it's all about data and numbers, and we gotta forget that the patient is why we all do this. Um, the pie is big enough, it's just being distributed in the wrong way, and ultimately, we're not going to kill a hospital by reducing the MSK that goes to the ER. We're not going to touch their bottom lines. But what we can do is we can free them up so that if my loved one is having a stroke, they're not waiting on a sprained ankle. But ultimately, one of the things that we keep alluding to is the cost of the ER. What we found really early on when we surveyed users of Hurt, they didn't really care about the cost savings, which was shocking to me because on average, it's about $3,000 per episode in savings if you go to an orthopedic office versus an ER. Just call it 3,000. That's a lot of money to everyone. And with $5,000 deductibles, it's really a lot of money for everyone. But here's what we found that was really shocking, but not really so much after hearing Andrew talk about his parent brain that kicked into gear. What parents want and what people want is they want instant reassurance that their kid or themselves are okay. And once we give them that, and I always teach my team, the medical response team, immediately, the first thing we do is talk them off the ledge. Once we get them to calm down, every sports medicine doctor knows you walk onto the field, you don't run, and you calm everyone down. And once we get that calmness and we can all take a breath and think, then we have their attention. And that's one of the unique features about what we really take pride in is that our response time is literally under 2 minutes now. So people are shocked. We even had to put a push button in our app to nudge people that says, "Hey, we're here waiting for you. What's going on? No, come on, we're here. Let's
Sure.
do this."
That's true. So let's shift gears a little. I love this discussion because all of us clearly are people who are committed to really good patient care, and that's what attracted me to be involved with this kind of an effort. That's what's attracted you all as client and partners to the Hurt Corporation. So what I'd like to know is maybe Kim, can you share a little bit about your experience about adopting Hurt and how the process went in your communities and your patient base? Because I can tell you from our observation, you took off like a lightning bolt, and you did some things that we just wanted to emulate. So tell us how you did it and how it affected your practice and how hard or easy it was.
Well, first of all, I will say that I think, our adoption was phenomenal. And I think it has a lot to do with the situation that we're here in East Tennessee, because we do have a monopoly healthcare system, and our community is actively looking for alternatives from the monopoly healthcare system. And so once we sent a message out, we sent Athena, we use Athena as our EMR. And once we sent a Athena message out to our patients, we we pretty quickly got 827 app registrations. And I think that's pretty phenomenal that people actually read their email and actually signed up for the app before they really even knew what it was. Before they didn't even know how to use it or if they were going to use it. But they pretty much did that immediately. And the other thing that I think is pretty phenomenal from us is in Little East Tennessee, we've had over 7,300 visits to our Hurt landing page on our website. And when you think about, the small community that we live in, it is very, very clear that our patients are looking for an alternative to care. The implementation from our standpoint was very easy, and working with the Hurt team, they were phenomenal in helping us get off the ground. We launched New Year's Eve weekend, which I thought was a great time to launch as people go out and potentially need the Hurt app. But from our standpoint, the response from the community has actually been shocking and overwhelming to me. I knew that people would adopt this technology, and I knew people would want to use it, but I did not know how quickly that they would jump on board with this. It's been phenomenal.
Yeah,
Like,
and
well,
what I have,
Fred,
yeah,
I haven't shared this with Kim yet, but you used to have this in the same spot where you go on your website. It used to say virtual care because I stalked you for a long time. I was trying to get you to be our client for a long time because I followed your journey on LinkedIn about the things that the hospital was doing to, limit your doctor's access to trauma cases in the ER, which is appalling. So I followed your practice for a very long time. But then, I kept seeing your virtual care
Mhm.
button. And then that button switched to Hurt, and we sort of took that piece over. We literally had one of your advanced practice providers reach out to us looking to join our team for some extra work because of the reduction in the amount of need for them after hours. And I know that's not maybe great for the APP, but we all here know today what an APP costs to
That's right.
man. So if you want to do your own program,
Mhm.
we need to say it, it's 4.2 FTEs. And to find those 4.2 FTEs is really hard these days. And we're all trying to keep our employees happy, right? There's only X amount of work that these folks want to do. And that's why I think we are really successful in bridging this gap for for practices who want to have this program, but really it's a pretty big drain. I mean, maybe you can comment on what you were
Uh,
doing virtual
yeah.
platform before you got us.
Yeah, let me speak to that because I do believe in this platform. We were running a virtual urgent care that we were staffing ourselves from the time our urgent care closed at 8 p.m. at night until 11. So 11 p.m. at night, 7 days a week. And what that was, quite frankly, was a great service to our patients, but a huge headache for me and the administration team because we've got to have somebody to staff it, number one. So you've got to have an APP to staff it. But the second thing, and probably more frustrating, was we do not have the technology development that you do with HURT. So developing the technology and trying to piece together technology that kind of worked most of the time was super frustrating. So I think what you provided us, it was a solution to be able to offer this service with a partner that we trusted, but we didn't have to staff it ourselves and spend the money developing the technology that clearly a group of 22 orthopedic surgeons doesn't have.
That's interesting because we talk to a lot of orthopedic practices. There are a couple comments I want to make from these discussions, and I want to turn it to Andrew. But first of all, your adoption of the HERT platform, your readiness for it is reflective of the great leadership that you provide in your practice. And I can tell you, talking with lots of groups, everybody tells us it's hard to get APPs to staff the urgent cares, that they need access, and that this has been a great tool. But also, what I wanted to say is that it really is a cultural thing inside of practices. We can tell when we meet people and we meet practices that they're ready to go because they get it. Kim, you clearly get it, and Andrew's group is the same. So Andrew, I I must say that just like in Watauga, but maybe slightly differently, the culture in your practice was really phenomenal and excited and ready to adopt this new technology and the new access. So tell us a little bit about, your journey and how it went getting started off, and how your staff maybe adopted it and things like that. And then also in the community, how you felt you launched.
Yeah. So I think I would add to what you guys are just talking about there. It's not just any APP that makes it work, right? You need experienced, tenured APPs to make it really work well. Otherwise, they're struggling, and they're basically reaching out for a lifeline to be able to do their job, and it just doesn't work, right? And so it's not just the general difficulty across the board from our industry's perspective. It's the hyper narrow grouping of them that are they're probably 5, 10 years away from retirement that really thrive. And so they're not just hard to find, they're very expensive to keep. And they're typically looking for some type of a challenge to keep them engaged and keep them happy with what they're working on. So it's a real struggle to find them, a real struggle to be able to hold on to them. And we continue to run into that challenge here in our own community with our in-person urgent care clinics. And so it's, from a launch perspective, that really is part of what we were after. And part of what drove us towards Hurt is we were looking for a way to take what we had seen, which was just massive, wild success with the availability of just some after hours access, nothing really crazy. We were running till like 8 p.m. in the evening is all we were doing. And it was just getting overrun. I mean,
Mhm.
people were becoming aware of it. And whether that's we call it urgent care, but I tell our team a slot's a slot, right? We're here to take care of patients, and I don't care where they've come from or what their issue is. We're here to take
Mhm.
care of patients, and so we call it urgent care. But I don't care if you're, working 9 to 6 or 9 to 5, and you just need a spot to come and get checked out on your way home in the evening. We're happy to take care of you. And so it was a way to extend that availability and that access to the community that was already there, but in an area where recruiting and retaining those folks is really, really intensely competitive and hard because we've got 4 hospital systems around us that are also competing intensely for that same access to talent. And we've got a lot of them that they're good because they've been in the OR for years, decades in some cases, right? They enjoy the challenge of being at the bedside with the surgeon, working on these problems, seeing patients in follow-up. They don't really get jazzed about the office side of the universe. We need their skills, but they don't get the same level of excitement that they once did, right? And so keeping them's tough. So this is a natural progress pathway forward for us to be able to open this up 24/7. No matter where you are, no matter what time of the day, where you might be, what's going on, you have that access point that's now available. And so we've seen same thing, just crazy adoption, well beyond what I would have expected. And it's continuing to grow, as we continue to push it and continue to promote it. Access continues to grow, registration continues to grow, utilization continues to grow, and it's cool to watch because it really is, it really is picking people up that, in many cases, would they have ever gotten to us in the first place? I don't know. I can tell you that if they end up somewhere else in the community and not here, I know they're going to pay more, and I will argue that I'll argue that we would give them the best quality it can be found anywhere
Oh,
in the
yeah.
community
Mhm.
too. And so it's been a really neat way. I hate to say open the funnel because it's not really a sales thing, but in some way it is, right? I mean, our community is unique in that we have two general groups that we're trying to reach with our message. There are people that have lived in the community for decades, and there are people who just got here yesterday. And
Mm.
so reaching these two different types of groups is tough, but it really comes back again to this is about bringing technology into the modern century, right? We're taking the
Mhm.
same techniques and the same abilities and the same ability to bring healing to a person that's been there for years, for decades. We're just delivering it via a better method is all it is. So it's
Yeah.
been really cool to watch.
So, Brett, I got to ask you now because you're going to give us a contrast. Tell us the experience at Hurt about trying to hire APPs and what a different feeling it's been on our side of the technological piece.
Sure. First off, our medical response team is absolutely phenomenal. Rock stars. I personally interviewed every single one of them, and the athletic trainers that were hired was a single post and hundreds of applicants in a 48 hours. And the reason is a lot of athletic trainers have been underpaid and overworked for many, many years, and quite frankly, underappreciated. Their skill, knowledge, and experience is phenomenal. And for whatever reason, they can't function like nurses in our clinics. And it's really a shame because that they are the perfect marriage with an orthopedic practice. Um, but they are tired of standing on the sidelines Friday nights. They're tired of working Saturday morning soccer clinics. This gives them a way to continue to earn a fair living, use their skills and training, and to be where they want to be to do it. When we hired our APPs, I put a single LinkedIn post. In 48 hours, I had 140 applicants, and I screened every single one of them, interviewed 40, and we got it down to some absolute rock stars. I mean, for example, when we had one of our onboarding meetings, we everybody has all this experience we're talking about, and we came to this nice young lady, and she looked younger than most of us, and she goes, "I'm a new grad," and I'm thinking, "Why did I get her? That's not right." She was an athletic trainer for 6 years before she got her NP. Oh, that's why. Like, this is the perfect person. That's the kind of quality that we find because they're looking for supplemental income or a better life balance to be able to raise their children. And so the talent is immense out there, and we've just created an avenue for them to use their skills on their own time.
Yeah, and I think, and I love that, Brett, and I would agree with you. We have been extremely fortunate to have access to an incredible selection of individuals, nurse practitioners, ATCs. But I also think that in addition to them wanting to have a lifestyle change, what I'm noticing is that they really believe in this model. they believe that they can have an impact on human beings in a way that's extremely satisfying for them. They can touch a lot of lives in a very short period of time. And so they embrace telehealth. And I think that your timing was great in bringing this platform to the forefront. And I think it's really been an incredible surprise to us. We didn't know that it was going to be that way with our practitioners and our ATCs, but yeah, that's really a special piece to it. So one question that I've been wanting to ask some of our partners is how do you look at the HURT platform from a business standpoint? Is it an expense of the practice? Is it a marketing tool? How do you all think about us now that you've been working with us for a while, how it fits in to the business of orthopedics? Andrew, why don't you go first, please?
Sure. I see it as a brand new channel, truthfully. Yeah, and I would say it is the forefront, but it's also the future, just plain and simple, right? And even to the point, maybe sometimes I push the line on this sort of stuff a little bit, but somebody's got to do it, right? And I think that's what's neat is that you guys are pushing the limits of what has been done thus far, and it's only going to go farther from here. Just a perfect example of this. I have an incredible pediatrician that takes care of my 3 kids here in our community. She's been here for decades in our community, fantastic pediatrician, but her office is overrun like most clinics are today. And so anytime my kids end up with something, every other day, they come home from school with some new thing, and it'll take me a week and a half, 2 weeks to get in to get seen, right? And so we use a tool called Blueberry Pediatrics today. And so for a capitated price per month, I'm not here to advertise for Blueberry, but for a capitated price per month, I have access to some folks who can take care of the simple, you need an antibiotic to kill that sinus issue or whatever it is that's going on. These mediums are going to become the norm, right? And I would argue that organizations that aren't thinking in this format are already a step behind the curve of where tomorrow is going to be. So people are going to come to us, of course, looking for the access and the convenience, but I think there's a day coming where if you don't have these types of technology and this topology to deliver the access to care, you're going to get left in the dust because people are going to push this line. They're going to improve the standard of care and the quality along the way, and it's just going to be the future. So I see it as the now, but it's future proofing our organization is what it is.
So I'm hearing you say that that there's real value to this. This isn't a marketing ploy. It's not just a way to capture patients. It's a real impactful thing that makes sense for human beings and for your practice. And it's a necessary thing that was a long time coming. And I love that. I think that's the way we feel at HURT. Kim, how do you feel about it with regards to the business of orthopedics? How does it fit into and maybe even a step further, how does it impact, maybe relieve some of the ongoing strains that are inside the practice? We talked about the APP thing, but are there any business things in orthopedics and in the practice of orthopedics that you've seen the HURT application and the HURT service help you with?
So I'll start off by saying that I love marketing the HURT app through our various channels of social media because today it's a differentiation factor. It won't be like Andrew said, like it won't be in 2 years or 3 years. Everybody is going to be doing this, and we will wonder what we did without this kind of availability. But as of right now, it is a differentiation factor for marketing. So I do love it because it touches people with something called access. So Andrew alluded to his kids. My kids are grown now, but Andrew and his wife don't have time to run to the pediatric office and sit and wait with 28 sick kids hacking because they're busy people. And so I'll go to the HURT app. If you're injured and you have determined that you probably don't need to go to the ER and you really don't have time to deal with that and go sit in the ER, then why wouldn't you do this in the convenience of your home? So it's also an access point, which I think is very, very important. So getting to what you said as far as, feeding other lines of business or looking at it through a business sense. For me, this feeds our walk-in clinics. And I believe, like Andrew, like it's not an urgent care clinic. I mean, you could have urgent care back pain since you were 16 and you're now 98, and you walk in my urgent care and we are going to see you. But what I believe this does is I believe it's another access point for our urgent care clinic, walk-in clinic, to get plugged in with, if they need it, the right specialist. And if they don't, then we've given them some peace of mind to heal. And with that, I will throw a stat at you. So, it's very important for me to track what is happening to these patients. Like, I just don't want to give money to you guys and just throw it away, because, our partners are not going to live with that very long, right, Andrew? Because our partners want to know where every dime is being spent. So we have to show them that this money is being used appropriately. So from our hurt cases, 69% of those cases, so I'll go ahead and round up to 70% of hurt cases come to our office. So that's important because you guys have determined that they need some type of follow-up. And that is either they're coming through our office from a walk-in perspective. So they've called Sunday night when we're closed. They're coming in Monday morning to get an x-ray, or you have directed them to the correct specialist that they need to see in our office. So I think that's important as we're looking at volumes and what this hurt application means. For us, it's driving care to the people that need to be seen. And to that, I look at as another access point.
Great. So, follow-up question on that one. So we do try really hard to, figure out when and whom these patients, our users, your patients, need to be seen, and that's really an important thing. Is there a trickle effect that's positive, say, for your patient access coordinators, the people who answer the calls? Does it affect them how does it affect them? Is there a positive effect on them with maybe unloading the stress a little bit of trying to figure out who needs what? Do we help in that area? Does it take some pressure off anywhere else in the business administration of your practice to have this service going?
So the only thing I'll say is the notes from the hurt cases are pretty darn good. And so when they're coming in the walk-in clinic and we have a hurt case, we pretty much know what is going on with them and what you've told them. So from that standpoint, I really think that having some knowledge before the patient walks in or before the patient is seen with an orthopedic surgeon is a great thing. The longer term effects of that, I don't think I can speak to yet, since we've just been live, basically a quarter in a month.
Yeah, yeah. So we're open. We're waiting with bated breath to hear how these things happen, because we are discovering a lot of things that we didn't know we would discover that are very positive. So Andrew, I'm wondering, what's the experience over at OrthoSC with regards to, everybody wants to know, can you measure the effects of something that you spend money on, like Kim pointed to? Is there measurability that you're seeing that you
Yes.
feel is positive? Tell us your experience with
Yes.
that, if you would, please.
I mean, I could tell you, not just looking at what's happening from a referral patterns. There'll be some folks that always ask, well, would they have ended up here anyway?
Sure.
Maybe, right? And I don't know that we can ever answer that. But what I can tell you is that I've gotten incredible patient reviews from people who have used this application. We send them a survey after every visit, say, hey, how do we do? How can we get better? Incredible patient reviews. We've seen people refer friends and family in because of it. They're now using it because a friend or family member used it and then recommended it to them. And I'll tell you, just even in a super simple micro level, most of our call centers across all of our organizations get killed on a Monday morning. They just get overrun. It's a real gift to have a bucket of folks that have already been transcribed, already detailed. All the information is already there, because we can read a lot faster than we can listen and respond to something. And so one of our
Beautiful.
goals is, how do I beat the patient to calling me back on Monday morning? How do I delight my customer, if you will, by proactively going after them to be able to say, hey, looks like you checked in this weekend. How do we get you in to see somebody today so that we can get this taken care of? And so again, it's a differentiator in how that we compete in the environment that we're in. And I think it's, you know, I love to read. I was reading through an article yesterday where Howard Schultz was talking about a Starbucks. It was Q1, Q2 earning or something like that, where the numbers had failed just a little bit, and he was talking about what he thought the driver was, and he said that he felt like moving the company forward required just maniacal focus on the stores, right? The experience that's happening in the stores. And it just hit me. That's it. That's it. It's totally what it is, right? It requires maniacal focus, just fanatical focus on the experience that our patients have when they come through our doors. And this is one of the ways that we stand out in meeting our customer where they are and helping connect them to the services that they need so that they can live a better life.
So that, I mean, I'm smiling ear to ear here. Brett, you gotta chime in and tell us how this is making you feel, my friend.
Well, it's hard for me to be quiet for so long because I dominate conversations, but just a couple of comments to maybe kind of bring this all together. Number one, when I built this platform, I knew that it had to be easy to implement because I took my least favorite partner that I've had, and I always had him in the back of my mind of how can I please this? It can never be pleased. So we made it simple. And
You got one of those, Brett? I haven't experienced that in orthopedics.
um, so I knew it had to be simple. And then even in a decade, the work that you leaders have to do is it's unbelievable. I mean, Kim, you've been in this game a little longer than me, but not much. We used to just have paper charts. I used to go my own patients. I used to not have all these roadblocks to doing anything in medicine. So I did not want this platform to be a burden on your team. And that's why I think it's important to say that our implementation is 90 minutes, maybe. It's not like doing an EMR or some crazy new platform that's going to just bog you down and make everyone mad. And then I sit in the same board meetings that you guys all sit in, and I know that my overhead is creeping up every single year. It's never gone down. It's not going to go down. I think that number one, we started as a hype company, just believe in us, and now we're a data company. We're creating all these dashboards for you guys to log on to prove our worth. But I think there's an immense opportunity in this marketing arena that I truly hate. I started out as the guy who voted against a $10,000 deal to be on the front page of the Yellow Pages. That's how old I am. I mean, we don't even have Yellow Pages anymore. And then my small group of 5 or 6 surgeons was spending 6, 7, 8,000 a month on marketing with an agency that just absolutely tanked, and it was a waste of money. So I know that in these boardrooms, we can't just go to our surgeon partners and say, we need to spend more money on this. I think it needs to be the message of redistributing the pie of marketing and creating us as a partner in your marketing campaigns and strategies and allowing us to help you amplify all those efforts by baking us into that budget. And then we're working really hard to prove our ROI for everyone because, like you guys said, we ultimately the surgeons are going to look at this objectively, regardless of how good a guys Fred and I are. They just want to know what is the impact on our bottom line. So that would be my kind of comment to wrap that piece up, I think.
The Hurt group, the Hurt team has worked very hard to try to deliver what it is that we think is a fantastic product. I'd like to hear from you. I mean, this may be a loaded question, but I'd like to hear really a true reflection of how you feel working with our team, how it's been, and if you have any suggestions for us, because one of the things we pride ourselves in is we like to listen to what our client partners have to say, and we try to pivot and deliver it. So are we meeting that goal? And if so, yes. If not, what ways can we do better?
So I'll kick that one off, and I would say to your Hurt team, it means a lot to me to be able to get up in the morning and stare in the mirror before that I leave my house and know that the work that I'm going to do today, while I will never touch a patient and our entire community is better off because of that. It means a lot to me that I know that I will do work today that matters in the lives of the people that in the community that I live in. And I've been in this community long enough and I've worked in this universe long enough that I walk past people in the community that I know that we help take care of. And so I would say to them, there are people in Northeastern South Carolina who are living a better quality of life because of the work that you do. And I'd say thank you for that. And I would add to that, keep innovating, keep pushing the bleeding edge of this thing. You know, I've already seen just in our short time of partnering with you guys, you're continuing to evolve, continuing to grow, continuing to make this thing better than it was yesterday. And that's an incredible thing to watch, right? Because I don't think I think we've just touched the tip of the iceberg of what this thing's capable of. And it's going to be really incredible to watch it continue to grow.
Thank you for that. That's very powerful and meaningful to us. Kim, any thoughts closing
Yeah.
up?
So I know that you don't know Andrew very much, but he is the nicest man that I have probably ever met in my entire life. And that was an amazing response that I would like to ditto. These patients don't need to be there. They need alternatives. And so thank you for keeping my community out of our hospital systems. That means a lot to me personally, and it means a lot to this practice. So thank you for that. For innovations, what I would say is we would love some ways of you guys helping us track our ROI. So certainly we are tracking that internally because it's really, really important for me to show the shareholders that I'm not wasting their money. But if there's any kind of interface that you can do with our EMR and look at the downstream revenue from the cases from a business associate agreement or any kind of data collection that we can partner with you, I think that would be a great tool and would only help your business as well. You know, we're tracking that. We've only have 3 months of data, and I think I need more than that to be able to speak to it. But I think any kind of partnership with the data would be beneficial to all of the orthopedic practices. It's very difficult for us and a very manual process for us to track that ourselves.
Well,
Great.
I would say bravo to that. We are working on that. We believe that integration to EMRs is kind of where we're going now. We're hearing that. Mr. CEO of HURT, can you respond to that and how you feel about that direction of the company?
No, I mean, any of this feedback that we get, and unfortunately, our CTO is not here and he deserves to be here because he's the co-founder and he's literally locked himself in a room for the past 2 weeks with a team of engineers to bring you guys an update that it's going to be absolutely mind-blowing. And as you alluded to, Andrew, what you saw yesterday is obsolete, and that is the way we're going to continue to drive and force this change. And to your what you spoke to, Kim, we know that data is all that matters right now. Um, Obviously, we put the patient care at our center of our company, but ultimately we have to demonstrate our worth. And all of that stuff is built and being built, and the integrations are carefully being monitored because some are good, some are bad, and we don't want to burden our practices. But we do want to give all that and create this pool of data that we share to make us all better.
Well, I just want to say this has been really fun for me. I mean, it's not work for me when I get to talk to people who are creative and driving the force of healthcare to the direction it needs to go. I want to thank Andrew and Kim very, very much for not only being here and taking your precious time to talk to us about this, but for being leaders in healthcare also, because we wouldn't be here without people like you. I would also say that, the summary points here is this is an amazing time in healthcare. We're doing something that does help people. I would encourage the listeners of this podcast to check out the HURT app. I mean, it's a shameless promotion, but honestly, check it out and see what it can do to help you to get better access to healthcare. And we think the rest of the story will tell itself. But thank you so much again. And Brett, kudos to you for being a visionary. You always say you're from a little town in Kansas, but you're a big thinker, man, and we're really grateful to what you've done to bring this platform to be. So thanks to everybody.
Without great partners, none of this works. And I would work and love to work and be led by either of you two as my CEO as an orthopedic surgeon. You guys are amazing. I see you at meetings. You're well respected. So I appreciate your partnership and all your trust that you put in us.
Andrew's much nicer than me. You should go work for him.
I don't believe it. I don't believe it, Kim.
No, ask Andrew. Andrew will tell you.
Nope. Kim knows what's up. All right, my friends. I've got to go. Or
thank you.
If I don't if I don't get home soon, I will need a Hurt app visit here.
Okay.
From what my wife
guys.
does, so.
Thanks again, everybody.
Thanks, Kim and Andrew.
Thank y'all.
Well, that was a great first episode, Fred. What a fantastic group of leaders that we got to talk to. I'm inspired. I actually would love to work for those CEOs as an orthopedic surgeon. They are truly fantastic partners. They're also not afraid to speak their minds and tell us what they need from us, and we're happy to pivot with them and innovate and really just deliver on our promise.
I agree with you, and I heard Kim loud and clear. They need some data to help drive the process of understanding return on investment. That's a very important thing for our clients. And, I just want our listeners to know, and other practices that may be listening, that is what we intend to do. We are working on that very, very vigorously now. But those two are really inspirational folks that I would have been proud to call my CEO when I was in practice, for sure.
Absolutely. And I think what you're going to see as this platform evolves, and we've come a long way in a very short period of time. We have tremendous innovation going on in our company. Our team continues to grow with phenomenal individuals. I'm not worthy of their presence. It's truly been an honor and a blessing to be around such great leaders, innovators, and thinkers. And actually, the center of all of this, again, you're gonna this isn't cliche. This is really what the foundation of this company is. We are taking back healthcare. We are putting the patient back at the center of what we do, because it's gone, it's missing, it's disgusting, and we're here to solve it.
Couldn't say it any better than that. I just want our listeners to know that this is the first of many podcasts to come. We are going to continue to examine what we can do and how healthcare needs to change, and continue to bring those innovations to healthcare through our clients' wishes. So we're really excited to have this first one under our belts, but really looking forward to what the future brings with Hurt Healthcasts.
Thank you all for listening to this first Hurt Healthcast. Like, follow, and subscribe to keep us at the top of your list, and stay tuned for more awesome discussions with great people and find out where this thing's going to go.
Don't forget to like, comment, and subscribe.